Hey, it's Ed, and welcome to this is the very first edition where we want to talk about Australia Health Week 2024, which is coming up March 20th through 21st in Sydney, Australia. And so I wanted to have a couple guests to explore what this is all about and understand why this is so exciting, because it's been going on for many, many years. And again, coming up not too long from now, it's the biggest, Sandip, I think it's the biggest healthcare tech conference in the Southern Hemisphere.
That's excellent, and one of the really exciting ones for us. I really look forward to it. Actively participated this year, and one word comes to life when I talk about Australian Health Week. It's all about community. So look forward to 2024 and what that agenda is going to bring.
And almost as important, Sandip and I were talking. He noticed my football jersey. We were talking a little bit of football. What was your favorite team again, Sandip?
Yeah, it was the Spurs, but I won't hold it against you, Ed. Considering you took our key striker, but let's leave it there. Let's leave it there.
But that's good. Yeah, no, the Australian women's team in particular is super, super good, on fire. And so the Olympics, it'll be interesting what happens in the Olympics in Paris next year as well. It
was so great to see as a country, seeing our women's football league not only grow, but the success they had in the World Cup. So very exciting for us as a country, and we're right behind football, of course, and it's a growing phenomenon in Australia.
Yeah, no, it's super cool. So I just want to ask you a couple questions. Let's start off with this. What's one technology that you're most excited about that'll enable digital transformation?
I mean, give you perspective, right? In my role, I oversee strategy, transformation, research, digital information, major capital partnerships. So one of the things that I focus on in totality across the whole portfolio is the future: infrastructure, technology, innovation, research. And when it comes to technology, one of the technologies that I'm most excited about is ambient listening. That's the technology that I'm most excited about. Currently available in the US, and we're doing our darndest to get it across to the non-US sector. And I think, considering that, as a hospital and health service at Gold Coast, we provide over 900,000 kind of ambulatory type appointments a year. Think about ambient listening in that context. In the world where there's global clinical shortages, Australia's no different. Just to see that acceleration, speed, and efficiency for documentation. That is the one technology that I'm really most excited about. And then, of course, we're in the buzz of generative AI. We're seeing a lot of the adoption of that. And so it's just AI in totality. I think that would be my near second. And, it's natural language processing, it's computer vision, and there's so much utility in that. But number one, ambient listening, that's the main focus for me.
Yeah, I love that. And Sandeep, I don't think it's a bad thing to sort of be, what do they call them, fast followers versus bleeding edge, because, you learn from other people's experiences, and you don't have to go through the same crises and the same spend and get this, and then you still get the same benefit or more. So it's not a bad spot to be in, for sure.
Yeah, and you're right. In my portfolio in digital, there is leading edge global firsts as much as there is the drag and drop innovation, if you like. Yeah. I completely concur what you're saying there.
So for Australian Health Week 2024, you're also on the advisory board. So what drew you to the advisory board?
Look, I and we all invest, particularly as executives or digital leaders or clinical leaders, in attending, such key events as Australian Health Week. And now, I guess what drew me into that kind of advisory board concept was a few things. One, to connect with peer experts that are, regarded in industry as experts in their field, and to really have active debate about how we use, such a milestone event like Australian Health Week in anger to deliver the right messages. That was one. Second is, again, as a community, we're investing our own time in attending these milestone events and hearing from the industry nationally, globally, about their thoughts on different domains. And I just wanted to do my bit to make sure that what we'll hear from as a community is truly leading edge, and it's truly timely for Australia to hear that topic. So I wanted to influence that agenda. And then thirdly, and as an active participant, I want to do my best to make sure that those innovators across the system, they're getting an opportunity to be tapped on the shoulder to say, you're doing something really important and the community needs to hear about it. And so another reason why I wanted to join is to make sure that we're bringing and giving those innovators, the forward thinkers, the right opportunity to share their vision, their views, their programs with the broader community. So those are the three reasons that I chose to be part of it.
Yeah, no, it makes total sense. And you really also made a good pitch for why others should attend, because as you pointed out, it's all the networking, and you get to talk to someone like yourself. You get to talk to others, maybe more who've done a little bit ahead of you, some that are a little bit behind you, and iron sharpens iron. You just help one another out.
And it's those structured, organic conversations that happen when you're on the floor and you finally meet a hospital that you heard a little bit about, and you get to unpack that. Hey, I've heard you're doing X.
Yeah.
And tell me a little bit about your experience. Or actually, we're doing this initiative and we've heard that you've done that. Or what are your perspectives? I really enjoy the kind of hybrid conversations, and also opportunity to connect with industry. There's always, a forward propositional industry being on the floor with all the sponsors of Australian Health Week, but also industry that's invited in. And it's a great opportunity to organically run into industry and observe, but also interact with something you might not even been thinking about that's transformed a part of the health. Health systems are such large organizations, and at Gold Coast is over 9,000 FTE here, 1,200 heads. And there's so many different functions that are operating in the hospital. So it might be the chance that you get to see, oh, actually, that's now forward thinking in terms of new technology and interventional neuroradiology, for example.
Yeah.
So it's a great opportunity to bring that to life as well.
No, that's awesome. Yeah, you're right, because it's not only the networking, but yeah, you also learn from the companies, and you get to see them all in one spot. So they're all right there, and you can engage in an in-depth way because you're like face to face. So that's pretty awesome, Sandip. We covered a lot in a really short time period. Everything from the importance of football, but also all the reasons why both of us are so enthralled about being part of Australian Health Week in 2024 in Sydney, March 20th and 21st. I'll leave you with the last word. Anything else that you'd want to say?
Look, I really look forward to connecting with the community. Ed, it's been great to meet you. Obviously, a pity that you're a Bayern Munich fan, but let's debate that on the ground. But also, really, my main message is I look forward to meeting you all at Australian Health Week, and it's like a savings account. You're going to get out what you put in, and I really look forward to everyone contributing and participating. And again, I go back to that one word that I described Australian Health Week. It's all about community. So see you all there at 2024.
Yeah, that wraps it up. Well said, Sandip. Thank you so much. And thank you everyone for watching.